friends, I am Dr. Abdequaem Chimthanawala. Since few days I am receiving messages that the Mathematica videos are nice, but add something about repertory, because selecting a rubric, which rubric to select, how to select becomes difficult for a practitioner sometimes, because some rubrics are very interconnecting, so we fail to understand which rubric to take when the symptoms come. It's a very exhaustive topic, but as few of inquiry have come to, I'll just take one soric rubric and put forth in front of you, and then understand how to select a rubric and how the rubrics are so interlinked. Today I'll take a very soric rubric, that is benevolence. Now first of all, you must know what is benevolence. Benevolence means disposition to do good, an act of kindness. Now such a person will do good to others at the cost of his own health. At the cost of his own health, that is important. मतलब ये आदमी दूसरों के लिए कुछ भी करेगा चाहे अपने आप को तकलीफ में डाल दे. That is benevolence. You can also say disposition to do good, to love mankind, to heal people. This is basically benevolence. ये आपको at least basic meaning तो पता होना चाहिए benevolence का. Now if you see the rubric benevolence, there are in the complete repertory 23 drugs, like from agaricus to ammonium to aurum metallicum to belladonna, calcarea, phosphorus, cicuta, coffea tosta, coffea cruda, hydrogen, ignitia, silicia, ledum pal, nux vomica, opium, natrum mure, stannum metallicum, silicia, pulsatilla, phosphorus. Now if you see all the drugs, few drugs are very angry drugs. In this few are very quarrelsome, few are very aggressive, few are mild, few are timid. So you fail to understand what to take. Then we say take according to miasms, the soric miasm, the psychotic miasm and the syphilitic miasm. यहाँ तक तो ठीक है, but now how to take benevolence? It is so confusing that there are few rubrics which are very interconnected to benevolence. For example, I'll tell you, affectionate. Affectionate also is very close to benevolence. Now if you take affectionate rubric, then the drug changes, then the remedy changes. There are different remedies in the rubric affectionate, which is very close to benevolence. Next is anxiety others for. दूसरों के लिए प्रति anxiety होना. Again a very close rubric. Again if you see the repertory, the remedies in that are different. Third, if you take generosity towards others, averse generosity towards others, strangers, averse as regard to his family. मतलब ये इंसान अपने फैमिली में बहुत कंजूस रहता है, दूसरों के प्रति बहुत ज्यादा generous रहता है. Means that patient is basically very averse in the family but generous outside. So see the connecting rubric: benevolence, affectionate, anxiety for others, or you can say generous too much, बहुत ही ज्यादा दिलदार. इसके अंदर भी अगर आप रुब्रिक रेमेडीज देखेंगे तो रेमेडीज डिफरेंट है. The rubric is different, that is generous too much. Next it is mildness. Next you can say sympathetic and compassionate. This is also rubric sympathetic. ये सब बेसिकली एक दूसरे से बहुत ज्यादा इंटरकनेक्टेड है. और यू कैन से वीपिंग sympathy for others with. So see one rubric for benevolence, and if you probe that patient, some doctors might take affectionate, some might take anxiety for others, some might take generous too much, or you find mildness, or you can say sympathetic, compassionate, or weeping sympathy for others. Everything is so close. Then it is an art how to take out the rubric and which rubric to give importance. If you see in benevolence, there are chilly remedies, there are hot remedies. If the chilly remedies, the most of the important chilly remedies which I have seen are phosphorus, belladonna, coffea, ignitia, nux vomica. Those are chilly remedies. And hot remedy, if you see, opium. Thirstless, if you see, ignitia and hydrogen. And thirsty, if you see, phosphorus, belladonna, coffea, nux vomica and opium. But this is if you take the rubric benevolence. I will take these rubrics like affectionate and generous and show that how the remedy will change if you take this rubric. So this is in short introduction about repertory, how to select rubric and why it is difficult to select rubrics. That's why a lot of inquiries from your side. In coming time, when I finish my mathematics of rare drugs, I'll start the repertory section. But for now, try to understand which rubric to select in your patient. So this is, my friends, benevolence. Go home and study benevolence in detail. First, get the meaning, that how will the patient tell you, how will you interpret, and the remedies. For now, thank you. If you like, please do subscribe and share.